Thank you all for tuning in to the TNT Effect, the Athletes Podcast. I'm Dr. Tiara, Doctor of Physical Therapy and Certified Athletic Trainer. And today I'd like to welcome Dr. Brandon Mines. He is board certified in family practice and sports medicine. So welcome, Dr. Mines. How are you?
I'm doing well, thank you. How are you doing?
I'm doing very well. It's been a long time since I last saw you, and that was in 2009. You were a team physician for the Atlanta Dream, and for those who don't know, they are a WNBA team. And so to this day, you're still head team physician, correct?
Correct.
Correct. And how has it been all these years working with the Atlanta Dream?
It's been a real good adventure. When we first started, it was the league, our team had just started, right? So we were just putting everything together. I believe it was 2008. So over the years, it's been a lot of learning along the way, figuring out what works best, the logistics of taking care of athletes and all those things that come along with it. But we've had a lot of good team players on both sides, the Dream and Emory Healthcare, that really help put everything together and keep it going.
Nice. And so, were you able to travel or spend any amount of time in the bubble with them, or did they have like specific physicians that they had who stayed in the bubble, or maybe a handful who rotated in and out?
Yeah, when they were planning the bubble, the WNBA league officials were trying to see if there were any team doctors who would be available to go down to the bubble, but it's really a hard call just because of the amount of time you'd have to quarantine before you could go in the bubble and how long you would be in the bubble. It just would take a lot from your practice. So what they ended up doing was they had some local physicians that basically work at that sports facility where they played. And they also were able to have some sports medicine physicians from outside the bubble go into the bubble. So Cindy Chang, she's a very well-respected sports medicine physician that takes care of lots of sports. So she was down there taking care of all the teams for several weeks, and then another team physician for the Chicago Sky came down there and was there, and they were always paired up with the local physician in the bubble. So they had a lot of work. I mean, it was only at most probably 2 to 4 doctors, some nurse practitioners, a few things like that. But I couldn't go just from my own obligations and clinical requirements. But we stayed connected, right? Talking to those doctors down there, and everybody kept us in the loop. So it was an interesting take on everything, but I think it worked out.
Okay. And yeah, that was I can imagine that being difficult to leave practice for so long, and then also leave your families too for a long period of time as well. And so now you're in Green Bay with the Atlanta Falcons, and you're also team physician for them as well. And this is game or week what, 4?
Week 4, yeah.
Okay. And so how is that going? Because there isn't a bubble for the NFL right now. So how are you guys moving and navigating through that?
Yeah, it's we have a lot of protocols in place that the NFL has devised with the help of physicians and the Players Association, so that we're trying to be as safe as possible with, testing and social distancing and kind of best practices, right? So it's tough because guys, like you said, they're not in a bubble; they are with their families, but you kind of it's almost like voting. Like every vote counts. It's like every guy counts. Right? You all have to do the right thing so that everybody doesn't get sick. And so, as you know, some things have happened in other teams where there's been some positive testing, but it's just one day at a time, and trying to do the right thing. That's basically what it boils down to.
If you can speak on it, what are some protocols and things that you all have put in place?
Yeah, it's essentially, it has to do with the things you've already heard about, where social distancing. Even in the facility and everywhere you are, you have to be 6 feet away from other people. And we have these little tracking devices, tracing devices, right? That will you can go back and look at and say, oh, you were next to this person for too long, so they can tell you tomorrow, like, hey, you got to be careful, don't do that next time. So there's tracking that way. Hand washing stations and sanitation stations for your hands and things like that. Um, and then really just daily follow up with the head athletic trainer and the coach, kind of talking about, hey, how did it go yesterday? Did we miss anything? Were guys doing what they're supposed to do? So you can kind of make on the fly adjustments to it. I mean, outside of that, it's really, you know, just a bunch of logistical things like, oh, only so many people on a bus and so many people on a plane and things like that. And everybody knows there's daily testing for everybody. So that's a big hurdle, which is really a new thing in sports. People weren't really testing like PCR testing daily like that. So that's been some challenges, but so far for the most part it's working. I guess we'll see as we get into flu season and winter time, but yeah.
Now, how does that work for, okay, you talked about all of the logistics, but from a human side, we like to connect and interact, and then especially when you're working with a team, there's that level of camaraderie amongst brothers and, female athletes and everybody who's on the team. Like, is it weird that that energy has to be disconnected and maybe even weird?
Yeah, I think it's a challenge. I agree that how do you strictly adhere to the social distancing without having those social interactions? And I think that's the challenge the league has, is that, you know, guys are going to interact with each other. They come up to you, they say, hey, fist bump, elbow. You're trying to, like, be, like you said, like a human, socially conscious human being, but at the same time, don't overexpose yourself. So it's a challenge. And I think what they're doing is they're hoping that, can you balance what people are naturally going to do with, can you keep this COVID under control by taking care of yourself outside the facility, all the testing, because there's nothing perfect, right? I mean, you can get it anywhere. I mean, look at, President Trump, right? Like, it's probably one of the best bubbles. And, so anybody can get it, but it's just a matter of, how you handle it and make that balance, I guess.
Mm-hmm. Right. So what other sports have you worked with or do you work with?
So I also work with the Atlanta Hawks. I'm basically a team physician where I help cover some games throughout the year, probably 6 to 8 games per year, where I'm at games helping out with medical coverage and sometimes some orthopedic coverage. And then more of a medical consultant, medical director position with Clark Atlanta University, and some high schools in the area, where I'm kind of overseeing how things are running and managing some of those sports medicine aspects.
Okay. So say you're at a game and an injury occurs. What is your role? Because you have athletic trainers. What is your role when an injury happens? Obviously, if it's a medical emergency, then you're most likely the one who takes the lead. But in other just, orthopedic type situations, what is your role in those scenarios?
So, would you mean with any particular team or just in general?
In general.
In general. So basically, athletic trainers, certified athletic trainers, are very skilled in their position, and we work as a team. So whenever I'm covering an event, I'm watching, I'm paying attention. If somebody gets hurt, I'm paying attention to, well, what's going on. And, like, let's say it's an ankle sprain, where I'm watching how it's being handled. And generally speaking, I have that communication with the athletic trainers where we can look at each other or hand signal, like, oh, hey, doc, I need your assistance here with this player. But because the athletic trainers are always taking care of these things, I let them go with the initial management and evaluation. And then when it's time, appropriately for me to kind of get in there and check, then I'll go check the athlete. It may be on the bench, it may be at the end of a particular period, um, or it could be on the field. If it's like, oh yeah, well, it's some orthopedic injury we got to get to now, then we get on top of it. So it just kind of depends on the level of it, severity, I guess, of the injury. So
Right. Right. So as I mentioned, like if it's a medical emergency, then you're like you're on top of it, right?
right, like
So
we'll have that with
yeah, go ahead.
concussion, like people get loss of consciousness, or something that seems obvious, then we'll kind of activate emergency action plans and kind of get into it quickly, as opposed to other lower risk scenarios.
Hmm. And so transitioning from the field or the court into the clinic, what does your role look like in a clinical setting? And it could be maybe a follow up from that injury, or even if we're talking about preseason and you're doing like preseason pre participation examinations and things of that nature.
Yeah, so the clinic is that I work in is basically set up for, outpatient orthopedic injuries, right? So someone sprained something, hurt something, they're not sure what's going on. They come into the clinic and I'm evaluating them for an orthopedic injury. We may have some x-rays and we're determining the treatment plan for that patient. And if that patient happens to be, excuse me, happens to be an athlete, then, I can communicate with the athletic trainer and the coaches and we come up with a plan for return to play. If it's someone not on the team, then I make sure they have a community-based plan, whether it's physical therapist or what the follow-up is going to be. So we kind of go with it that route. Sometimes there are pre-participation examinations that we'll do in the clinic, primarily with if it's certain high schools or certain college teams, then we may do something like that, which just kind of depends. But that's how my clinical setting would work.
Okay. And what does the PPE consist of?
Yeah, so the PPE it consists of a few things. You're basically thinking about it like a screening test. You don't want to miss anything important that could be really catastrophic or or problematic in the athlete as they're playing a sport. So the first part is really, history where you're going over, have you ever had this problem, this surgery, this type of injury? There's a big emphasis on cardiovascular health. So there'll be questions on, have you ever had chest pain, passing out, racing heart, like things like that. Has anyone in your family had sudden cardiac death? Because you want to catch somebody who's at risk for sudden cardiac death, which is one of those things that we have a hard time, managing because it's so sudden, obviously by the name. So you can try to get some historical data on that. You're trying to see if there's any orthopedic risk factors where you can catch some of these questions like, oh, I've had ACL surgery or this or that. And then there's also questions about, psychological questions about, are you happy with your weight? Or, are you happy with your sport? For women's health, there's important questions on, you know, um, basically bone health and disordered eating, or just kind of a lot of these things that athletes run into that you may not just ask on a normal kind of, if you're just talking to somebody, unless it's on a sheet to remind you, right? So that's the main historical component. And then there's all the I guess the data, right, where you're getting vital signs, height, weight, a good physical, orthopedically and medically, where you're doing heart, lungs, and checking everything you can. And then you give them a guidance on there and say, hey, here's what you need to do. I think you're cleared, or you're cleared with these recommendations that you need to get this checked out or get your ankle rehab or whatever, or you're not cleared because I'm concerned about a possible cardiac problem. So you need to go do this test. So it's not saying someone can't, you're never going to play a sport, but it's just a screening test to say, you know what, if we don't like what we see, then we got to do a little bit more, digging to make sure that you're safe to play the sport.
Absolutely. And so working with the various sports that you do work with, what are some common injuries? And you can go maybe sport to sport.
hmm Yeah. So with basketball, you would say, ankle sprains. They're going to dislocate fingers and jam fingers. A lot of shoulders, just because taking charges and by nature of how they're playing and how you have to shoot, you can get some of these shoulder injuries. Not a lot of concussions in basketball, like every now and then you'll see that. Whereas in football, it's concussions are big, ACL injuries, just soft tissue injuries, hamstring pulls, ankle sprains, those types of things. I mean, of course, with football, I mean, everything's fair game. Everybody hurts everything. Just what's at the top of the list. But those are, I think, the more popular injuries or more common injuries, I'd say, um, that you see in those sports.
hmm And so dealing with that player who is injured and they're not quite ready to return to sport, how do you handle those situations? And they're kind of like, I want to go back and play. Yeah, how do you, hopefully convince them that you're not ready and you should really take the time to recover?
Yeah, I think you can think about it from, for example, there's the immediate reason why you can't go back, run the sideline. Here's the reasons why. It's easy when you say you want to play, but your ankle hurts. Go ahead and cut and run. Oh, see, you can't do it. You can't play. And you try to explain that from the standpoint of you're you're not helping your team. by being so limited, and you're not helping yourself because you can hurt something else because you're not effective right now. The tough part is, like you, probably the other part of your question, which is, well, what if it's 4 days later and they want to go back, or some return to play question? We try to pull out data. Some people respond to data where we can say, hey, based on your quad strength or your hamstring strength or this type of hamstring strain, you may feel like you can go back, but 85% of people who go back with this injury get re-injured, so it's not in your best interest. You try to kind of blend that in, um, and it's because the easiest thing I think is showing somebody what it's like, because they may think they're ready, but then when you have them try to do things, it's like they can see like, oh yeah, you're right. I guess I'm not ready, you know. And then when all else fails, you have to remind them that I'm there to protect them as their physician. That means I have to sometimes protect them from themselves. Like, my job is to know the medical and orthopedic risks of this sport. So if I have to be the bad person and say, look, you're not ready, it's not safe for you to go back, and here are the reasons why. Perfect example, someone gets mononucleosis, they have to sit out a few weeks because of possible spleen injury, right? So they will feel fine. Like, doc, it's been 2 weeks. I feel fine. Like, well, here's why you shouldn't play. Like, if I let you go back, something bad could happen. So you're trying to explain that to them, and just kind of put your foot down there. But most people get it. You usually don't get into a battle with it. So
Right. Okay. What about that player who's been out 6 months, 9 months, maybe even a year, and they're on that cusp of like just being ready, but there are like a few little functional tests or different things that they maybe haven't quite passed them just yet. But they're feeling great, feeling amazing, and you're just like just a little bit longer, but they're like, why? Why not? Why not now?
yeah. So I think when those situations, you have to look at all the factors at play. So sometimes that's going to be, what is the risk of injury? What is the you know what is the need of the team? What is the need of the athlete? It depends on the sport, depends on the level of sport. I've dealt with professional athletes where they really want to play, and maybe they're not at risk for injuring something that bad, but maybe they're just not quite as effective, and it's better for them to just get out there and do the best they can, and hopes that because they have other factors at play, contracts and agents and team obligations, right? So it's always boils down to safety, right? So if they're missing the marks, like you said, on some few points, or somewhere like, oh, your quad strength isn't just quite there, or your range of motion is just off, as long as we think it's safe and you're close, then then you bring in coaches and GMs, and like, hey, they're not 100, they're maybe 90%. I don't think they're gonna hurt themselves, but that's all you're gonna get. Okay, so if you want to go out there, if we wait 3 or 4 weeks, I think they'll be 100%. What's more important? So then you have to have that conversation. So
Yeah, that makes a lot of sense. And so, moving on into working with particularly your youth athletes, and of course you're having to deal with parents and all those different things when it comes to the development, working with those athletes as they're going through the different sports. What is your recommendation when it comes to a young athlete specifically playing one sport year round versus being a multi-sport athlete?
yeah, um, we like the ability for athletes to get more experiences in other sports. I mean, there's various studies that show it's a good thing to just going in different sports, learning different skill sets, and how that translates to other sports. So there are certain sports that studies show you should focus on at a young age, and like that's all you're supposed to do, like gymnastics and certain things, right? But for the most part, you're going to be a better athlete if the younger athlete can actually, oh, I do baseball and I do football, or I do softball and I do field hockey, or whatever. Just because you learn different things, and I think that that's key. I would always encourage a parent to encourage their kid to, like, look, we need to do some different sports. Now I know it gets hard with some of the level, like travel baseball and AAU basketball, all these things. It's kind of like you're kind of sucked into doing all these things, but it's I definitely think it's in the best interest to get some varied sports in there.
Now, does some of that single sport focus play into some of the injuries that some of these kids have?
So yeah, we think so, and it could be just because of the intensity or just the repetition. So like if you're playing baseball year round, like let's say you don't get a break from baseball and you're pitching all the time and you don't have proper rest, then you can get some of these growth plate injuries or some of these other soft tissue injuries that wouldn't have happened if you switch from baseball to, oh well, in football I'm doing this, or in basketball I'm doing that. So it's like anything else. If you just keep doing the same thing over and over, you're just at a higher risk of putting in getting an injury in there. So I think that's why we see a lot with just gymnastics, right? I mean, that's what they're doing. I mean, handsprings and tumbling and a lot of wrist compression and stress fractures and things like that, because that's basically happened 365 a year, right? So yeah, I think that does factor into it. So I think you'd have less injuries if you were more varied.
Hmm. And so, I guess going into some of the best or giving tips on preventing injuries, I guess maybe multi sport could potentially be one way. But also give us some more, I guess, practical ways of preventing injuries.
Yeah, I'd say, I mean, you want to have a game plan in place as far as how you're working out. Meaning, one of the biggest issues is progressing too fast. So people who, if you try to increase mileage with running too soon, then you're at increased risk for stress fractures or tendonitis. Same thing with sports. I mean, there's for throwing in baseball, you have to progress at a gradual rate. You don't go from 0 to 100 miles per hour. So it kind of depends on what this factor is. Like if you're working within the team setting, then the recommendation would be, hey, stay in touch with the team athletic trainer and the coaches who are supposed to have the training on, hey, here's how we have to progress you through this sport so we're not going too fast and getting overuse injuries. And then on the other side is not trying to do skills that aren't in your skill set yet, because then that's how you can get injured if you try to do things too quickly. Like maybe something like gymnastics where you're not ready for that skill. You have to progress. Otherwise, you can actually get an acute injury, right? So it's easier if you're in the team setting. I think if someone was, I don't know, by themselves or like, oh, I just want to start running or I'm going to start playing tennis, you want to increase gradually. Like, let's say you were starting to run, then you don't want to run one day and then increase everything the next day. And what I mean by that is the first thing is you're supposed to gradually increase like how often you're out there, right? Just like, oh, I go 2 days a week and then 3 days a week. You can gradually increase the distance you're out there where you say, okay, I'm gonna run a little bit more, or you can increase intensity. Like I'm gonna pick up the pace and go faster. You don't want to increase all three at once. Like, oh, tomorrow I'm gonna run further and harder, and longer, and more frequently this week. Like that's how you set up for injury. So
With a
everything
new
has
pair
to
of
be
shoes, right?
right. All that got to be gradual.
Gradual. And okay, so strength training can play a role in injury prevention as well. And everybody has their opinion on um, when kids should start. What does the science say from your experience and the many years that you've practiced? I guess what age would be a good time to start strength training, and is that body weight versus actually loading them?
So they've done studies on this, and what we found out is it's really more about gaining the experience and kind of feeling like you're a part of the sports. I don't know, the sports program where you're like, oh, I'm lifting weights. This is what sports are about. Because you're not going to get a big muscle gain until like, for example, boys go through puberty, right? So maybe 11 or 12, then maybe if they're lifting weights, they would see muscle gain. But it's actually okay. Like if you had, and like sounds crazy, I know, like 8-year old, like, oh, what if my 8-year old and we were lifting weights together? That's okay. It does not stunt growth. Now we're not doing major squats and lunges, right? But there's that a little weight and they're just learning how to do it. And they've done some studies, and I don't remember off the top of my head, but there's been positives to it. Like neuromuscular training, when they do it. So it's all has to do with moderation, because you can't push a kid and they're not going to get the strength gains, right? But maybe they get into a habit. So, but if you're looking for actual, hey, when can I get these muscle gains? It's really more about that pubertal stage. For boys, more like 11, 12. For girls, maybe 10 or 11 or something like that. But that's how I would think about it.
Right. And one way that I like to, I guess, kind of be like a gauge for it is, can they master movements before being loaded? And if they can, then you can start adding weight.
Right. Yeah, it's a good point. You gotta be able to do it with your body, and if you can do that comfortably, then yeah, then you can add some resistance. So,
Absolutely. Okay. And so now what are some recommendations that you will give younger athletes who want to play on a college level, in at the professional level? What advice would you give them? And also, what advice would you give parents?
um, so uh, the advice I'd give is you have to have a good foundation. Like, you need to have an understanding of what it takes to remain healthy. So you have to have good sleep hygiene, good diet, how to take care of your body. I think you have to, understand what it means to work within the team concept, meaning whatever sport you're in, if it's a team sport, how do you fit into that? And I mean, part of that has to do with, I guess, the camaraderie, but also I think just what your responsibilities are. So I think you have to know how you fit into a team. Um, I think you have to understand how to listen to your body and how to listen to people who are telling you, hey, you need to work on this, or you need to work on that, and not overdo it. So that's kind of the main thing. I think it has a lot to do with and also, I mean, understanding, like, well, what do we mean by goals of playing in collegiate or professional. I think they also have to understand, you know most vast majority of people don't really get to like a Division 1 level or a professional level. So what are you doing if you're 14 and you say, well, we want to go to UGA and then we're going to go play in NFL? Like, okay, I'm all for having goals, but you also have to understand, 0.1% make it or something, so you kind of have to. I think it's important to have other interests. Like, what if you can't play professional sports? What else do you like? And how can you match that up into, if you love sports, maybe that's an avenue. Like, think about other things in sports that you would like to do, but just have some other plan. That's I think that would be important. So
Yeah, you touched on a lot of points. So one, what does it mean to have good sleep hygiene?
yeah, so good sleep hygiene has to do with making sure your body's in the right place to get, I guess, the proper amount of quality sleep. So that would mean, oh, within maybe 6 p.m. and later, I won't drink any caffeine, or like I'm really watching what I'm putting in my body. You know, trying to not expose yourself to too many bright lights too close to bedtime. Maybe you go into, maybe turn the lights down or something, and you want to have a consistent bedtime, where you're not. I mean, you're not trying to go to bed at midnight and get up at 8 a.m. It's better if you did 10 p.m. to 6, because our natural rhythms are set a certain way, right? So you want to have a consistent bedtime. You want to try to get, at least for most people, 8 hours or something like that. You're trying to get a good amount of sleep. You're trying to stay hydrated. Um, and try not to do things in bed that would affect sleeping. Like, you shouldn't be working in bed, or like working on your computer in the bed, stuff like that. The bed should just be for sleeping, and so that kind of helps your body get into a better sleep routine. So those are some of the simple things that we talk about for that.
Winding down, getting ready for bed. Yeah,
Yep.
that's good points. Good points. Um, Before we go, any last words or any other advice you like to give?
um I would say, just, everybody being open to what the athletes are going through, and they're kind of, I think, stuck between a rock and a hard place sometimes, as far as what their goals are and their skill set. And I think we just have to kind of help them understand that we're on their side progressing through their sport, but I think it's also important to have, a strategy for what else do you like. I mean, it goes for professional athletes. I mean, look at NFL. I mean, how long is an NFL career, right? 4 to 5 years, or if you're lucky, maybe you make it to your mid 30s. Well, you're probably going to live 50 more years after that. So what do you want to do, right? So I don't think we do enough of like how we treat, talk to kids like, oh, well, what do you want to be when you grow up? Well, how about when you're already a football player? What do you want to do after you retire? Oh, I don't know. I hadn't thought about that. So, or if college, like, I mean, I think we should always keep their future in mind, because I think that's important. I mean, that's just kind of one thing I was thinking about. Um, but overall, I just think everybody should, in the sports medicine world, just keep themselves educated, going to conferences. I think participating with multidisciplinary, approach. Because I work with sports chiropractors, I work with physical therapists, I work with neuromuscular therapists. I mean, there's something to everybody. Everybody has something to offer, and you have to keep an open mind. But your athletes they're gonna do what they want to do, and you need to understand what everybody's doing, and it's gonna make you a better athletic trainer or medical provider. It'll make the athletes appreciate you more. Like, oh, she knew about this neuromuscular treatment I was doing, or acupuncture, or like this other thing, right? So I think that helps you with your career, right? It helps you get a buy-in from the athletes that you actually care and you're like on top of it. So there's a lot I could say on that, but that's kind of things that just jumped in front of my mind.
Yeah, the point about athletes being prepared like after their athletic career is important, especially thinking about it at a very early age, because you want to make sure you nurture the passion and help them reach for their goals, but at the same time, sport at some point it's not going to be your primary thing. So you have to figure out what it is you want to do post athletics, and that is so important to start cultivating that at the same time you're cultivating their sport dream or their athletic dreams.
Right, exactly. Well said.